Andy Patrol asked me to come.
Wonderful. Thank you for coming, Lynette. Thank you.
Let me know if I should move.
I think you're okay.
Thank you, everyone. I'm Congresswoman Jan Schakowsky from the 9th Congressional District, which we are in right now. And I just want to thank everyone for being here to support the notion that unless we vaccinate everyone around the world, everyone is in peril. This is not about making sure we get vaccines out to developing and poor countries because we are such good people and care about the poor. No, as much as it is about protecting all of us here in America and everywhere, even in the richest countries. So I will be introducing a number of people who will speak after me. Let me just say a few words. So we're standing out in front of the wonderful Howard Brown Community Health Center, an organization that has done so much for the community to make all of us safer, and particularly to focus on the LGBTQ community, and Walgreens, where vaccinations are going on right now. So I want to tell you that we've been in this perilous situation before. In the 90s, when HIV/AIDS was running rampant in poor countries, the big pharma companies were not sharing the antiretroviral drugs, and millions of people literally were dying. And I was among many people who directly spoke to the President of the United States. And I said, this cannot be about profits before people. It is time now to make sure that everyone has access to these life-saving medications. And he said to me, I'll check that out. And he did. And he said, I'll get back to you. And he did. And I even heard from the U.S. trade representative that he made the decision that they would require that these drugs be made available, saving, belatedly, but still saving hundreds of thousands of lives around the world. Here we are again today. We have an even bigger problem with a pandemic that threatens humanity everywhere. And right now, our President of the United States on May 5th said he wanted to see what is called a TRIPS waiver, a trade-related intellectual property rights of the pharmaceutical companies should be waived temporarily at the World Trade Organization to make sure that these drugs go everywhere. These vaccines go everywhere. So we thought when the President of the United States said he supported it, that the rest of the world would as well. But in fact, the European Union, the UK, no, they did not agree. And that was May 5th when he supported it. And here we are in November, and we have done nothing to make sure that those drugs go out from Big Pharma around. Here's what we want from them. We want them to share the recipe. We want them to make it possible for these countries to be able to manufacture the vaccine themselves. Not wait for our leftovers, not wait for charity, but be able to actually do the manufacturing themselves. 130 countries in the world, led by South Africa, have demanded that this happen. And I tell you something, in the meantime, the United States of America is losing the battle of vaccine diplomacy because China and Russia are delivering vaccines. They're not very good ones. They're not as good as ours. And yet we have the pharmaceutical, Pfizer and Moderna especially, who have these wonderful vaccines. The other thing that's a concern is that if, we've seen variants already, that it could be sooner rather than later that there will be a variant that is resistant to the current vaccines. And then we're at ground zero, starting all over. The American people want to see vaccines around the world. Right now, in poor countries, maybe 3-4% of people who have had shots in arms. 5 million people have died around the world. And of course, we've had so many thousands, 750,000 here in the United States of America alone. This is a deadly and wily virus that we're up against. One other point I want to make is that U.S. taxpayers have spent billions of dollars helping to develop the research and development for these vaccines over many years, getting ready for it, and distributing vaccines here in the United States. And so taxpayers deserve better to make sure that we are protected. So we call this a TRIPS waiver. There will be a ministerial conference of nations around the world that begins on November 30th, and it goes for 4 days only. And this is the moment that we should have the United States taking the lead and saying no more delay. We have to work together to give a waiver so that the recipe for these vaccines can go out everywhere around the world. So we are calling on our government to do even more than just say they support a TRIPS waiver, but to go to this conference and demand that something really happens. So I want to say that, you know, we're talking about Walgreens, but the fact that the Howard Brown Community Health Center knows how important it is for us to be able, where we miss the boat during HIV around the world. So let me tell you who is here and call on some of them to speak. We have a very important person, Kathy Christine Christeller, who is the Executive Director of the Chicago AIDS Project. Come on up, Kathy.
Hello, my name is Catherine Christeller. I'm the Executive Director of the Chicago Women's AIDS Project, and I have been working in public health for many, many decades, since the early days of the AIDS pandemic. And I'm thankful for my shots and for my access to a booster. But I want to say we cannot boost our way out of this pandemic. And that's what it looks like we're trying to do. We now have a majority of the world's citizens who have absolutely no access to vaccine at all, whereas we have more vaccine than we know what to do with in this country. That is called apartheid, and we cannot let it stand, and we cannot let Biden get away with signing the TRIPS waiver but doing nothing else. There has to be more. There has to be action. The administration needs to release the mRNA patents and provide technical support to increase vaccine production around the world. This is totally doable, but only if there is political will to do it. The New York Times last week identified 10 companies capable of handling this type of production, which, by the way, is much easier to produce than the old type of vaccine. Okay, so there are a lot more companies that can do it, and they actually printed an entire list of who could do it and what support they would need. As Jan mentioned, we all remember, or at least many of us remember, that when the HIV epidemic raced across Africa, we were told over and over again that it was unrealistic to expect to treat people living in such a poor continent, and that we had to be happy with the new treatments that became available, the multi-drug therapy that has been such a success in our country and in Europe. We know now that that was a lie. They could have broke the patents. South Africa organized then also to break the patent. And by the way, they didn't actually break the patent, but we found other ways to produce generic drugs. We need to step up and this time and really do the right thing. The Moderna vaccine was produced with the support of US dollars. We need to get the patent released. We need to give it to these 10 companies. We need them to ramp up production, and we need to provide them technical support so that can be done. And we need to start distributing vaccine before millions of more people die. Thank you.
Time is of the essence. We need to move quickly. So, frontline workers, people who have, throughout this pandemic, actually put their lives on the line, understand how important it is. Many of those work for unions, SEIU in particular. SEIU Healthcare represents frontline workers. And let me introduce Ann Igo to talk about how important it is for the members of her union that we get vaccines around the world.
Good afternoon, everyone. My name is Ann Igo. I serve as our Vice President for Hospitals for SEIU Healthcare. We represent 90,000 frontline workers who have been on the front line of this pandemic for almost 2 years now. And before then, they were fighting a healthcare. It's because we continue to have a society that puts profit before patients. This has been a hard pandemic for everyone working the front lines. And it's hard because folks don't get paid enough. They're dealing with folks who are sick and dying and have all kinds of economic and family issues. When people started getting vaccinated, our members had hope. They had reason to get up and think this is going to get better, because for a long time before the vaccine was being given, folks didn't know if it was going to get better. It was one surge after another surge, and it moved around the country and moved around the world. The truth is vaccinations work, but they only work if people get them. And they only work if they are given out to everyone. We fought hard when vaccines became available to our frontline workers, that every frontline worker got them. Not just folks working in nursing homes, not just folks working in hospitals, but to home care, to educators, grocery store workers. Every single person who was working on a front line needed to have access to them. What we know is that there are all types of diseases that are out there, and it's not comorbidities that happen, but when you are poor, it is harder to get health care. It is harder to get help when you get sick. And we can't continue to see our members, our communities getting sick. And again, these are communities around the world. And the diseases that we're already up against, heart disease, diabetes, right? They don't spread. COVID-19 spreads. And it doesn't care if you're rich, doesn't care if you're poor, doesn't care what country you live in, it doesn't care if you live in a rural community, doesn't matter if you work in an urban community. COVID-19 continues to spread, but what we know is that it stops spreading and slows down significantly when we see vaccines. The numbers that Congresswoman Schakowsky shared, about 5 million dying over the past period of time, has slowed down and is now almost exclusively, we're seeing the deaths among unvaccinated folks and unvaccinated pockets of our world. We have the ability to do better, and our union stands with ensuring that vaccines are distributed everywhere and that we are doing our part to ensure that that happens. And the way to do that is to take the profit out, release the patents, and ensure that everyone has access to the vaccines and not just those countries that can afford it. Thank you.
I wanted to mention the president, the presence of, I'm going to say the letters, but I'll say the BCTGM Local 1. That's the bakers and confectionery workers and others who are here today. I don't know if you know. Okay, but you're here, and that's really important. If there's any questions, and actually, I certainly want to invite the kind gentleman from the press who came, but if any others have a question or comment, Anybody back there? Okay. Well, we have our work cut out for us. We want the United States to press forward to make sure that these vaccines can be produced all over the world. I'm sorry? Oh, okay, is someone from Howard Brown prepared to speak? Frontline worker from Howard Brown? Am I wrong? Okay. Okay, great. So we want to make sure that on November 30th, when there's the ministerial conference, that we are able, as the United States, to push hard to make sure we get those vaccines around the world and save lives everywhere. By the way, the 5 million is the worldwide number. But still, we have 750,000 people in the United States now who have died. We know how deadly this virus is, and we can't let it spread around the world. So thank you very much. Appreciate you.